This panel is called Who Runs the World, for good reason. We are talking to trailblazers in women's health and wellness. So please join me in welcoming to the stage Deborah, Dázon, Kendall, and Allyson. This panel is focusing on advancing women's health and wellness at a time when conditions for women couldn't possibly be worse, unfortunately. The Congressional Budget Office has released a statement that about 16 million people will be uninsured by 2034. 7.8 million are expected to lose Medicaid, and roughly 24 million women are currently relying on Medicaid for essential services, including maternal health care, cancer screenings, mental health support, vaccinations. We can go on. So Deborah, and Dázon, I want to start with you both. Between your decades of work, you've both helped shape the national response to some of the most urgent health crises of our time. And your organization, Sister Love, has been a lifeline to women at the margins for over 30 years. So with all that you both have witnessed, what are some of the most persistent structural barriers women still face when it comes to accessing comprehensive care, and why isn't medicine alone enough to close those gaps?
I'm gonna let you go first since she called your name.
Well, thank you so much. And it's an absolute pleasure to be in this conversation and to continue to bring the particular stories around women, and I would be remiss if I didn't say Black women especially, into this conversation. With Sister Love, for example, for the last 30 plus years, we have worked intentionally at making sure that we're recognizing, because all those numbers that you just called out are all stories. Every single one of them is a story of a woman whose life is connected to other lives. And the ripple effect of that is also untold so far. And what we know, though, is focusing in on the intersections of their lives and how all of those things fit together. So our work is in the intersection of sexual, reproductive, and maternal health, rights, and justice, which means we have to focus on equity. Some of the key structural challenges you were talking about at the national level in the state of Georgia, where I live, work, where I'm from, born and raised, we have 95% of our counties do not have access to the full scale of reproductive choices. 50% of the counties in the state of Georgia do not have an OBGYN. 40% of the counties in the state of Georgia do not have a pediatrician. So when we look at the fact that healthcare isn't even accessible, and if you come into the inner cities, where the healthcare is located in certain parts of town, which mean it makes it very difficult, transportation, childcare, leaving work, all of the standard things that we find every day, and then having women who are responsible for themselves and everybody else. The other structural thing is we're socialized to take care of everybody else before ourselves, and we haven't turned that around. But I also think that the structural inability to center women's lives in the healthcare response is the biggest part of the problem. And I love my men, I love my brothers, but what we do know is that when you take care of the man, you take care of the man. When you take care of the woman, you're taking now care of the family, the community, and all of the other things that she is the backbone for and upholding, without the credit and without the resources and without, of course, understanding the value that we bring. So centering women in the responses means you will eventually, if not inevitably, get everyone involved in one way, shape, or another, because the women will do that.
Yeah.
So well said.
Yeah, I'll just add to that. I am a nurse practitioner and a physician's assistant by training, and I started my training in women's health. And I started that because of trying to learn about health for my community. And I think one of the things that's structurally a problem, and it's going to be a bigger problem, is this whole issue around DEI in medical schools. And so when we think about who's taking care of the patients, are they trusted voices? You know, there is some systemic problems that are happening in the healthcare system that are, I think, bubbling back up, quite frankly. And as they bubble back up, will there be healthcare providers who know how to take care of women, and particularly Black women? You know, there was a time there were more women in medical school, but with DEI, let's see what happens with that. Will women be in medical schools? Will they be learning about women's issues? I mean, we're just now learning things like heart disease is different in women than it is in men, and that's because women went to medical school or became nurses. And those are some of the structural problems I think we have to think about, in addition to what Dázon talked about, because when people get to the healthcare system, who's taking care of them? And that's a structural issue, I think, that needs to be dealt with. And particularly around HIV in Black women. And so we can talk about that a little more. I'll let somebody else talk a little bit. Okay.
Kendall, I'll kick it over to you. You have built a massive global community, not just as a Peloton instructor, but as a mental health advocate who speaks very candidly about depression, about anxiety, about resilience. And you've also been an advocate for Black maternal health. And Dázon, you were calling out reproductive injustices decades before it was part of the zeitgeist. Thank you. So in both of your views, what's still missing from the national conversation about women's health, especially for communities who have historically been ignored or harmed by the system?
Absolutely. And I think what's operative and what you both brought up that's so key is that we need to have people in healthcare who can relate to their patients. There has to be representation, because if someone at their most vulnerable, particularly in a state of mental health or a mental health issue, is trying to find a provider, a mental health care provider, and this particular provider doesn't have a shared cultural experience or representation, how are you going to feel safe in your most vulnerable state to continue to grow, evolve, and seek help and support? And that's something that we have to make sure we are putting a priority to help not only imbue more of this talent into the healthcare system, but also protect these jobs, protect these individuals. Because if you're not represented, how are you going to be able to seek that help and really thrive? And it's exactly it. If the women are taken care of, and if they feel seen and if they feel heard, that trickle effect of all of the people they touch and connect really changes. And we need to see that representation shift within mental health in particular is the area that I'm most focused on. And it's very heartbreaking for me to have conversations with friends and other folk and realize someone will say to me, I try to find a provider and I just don't see myself in what's offered to me. And this is a very significant issue we need to really focus on changing.
I talked about dating doctors, dating therapists.
Yes.
Just as difficult and just as important.
Yes, trying to find a great therapist that you connect with is already challenging, so absolutely.
Absolutely. I think the other part that goes along with that is that we fail, especially at the national conversation, to realize and value community solutions. That every single day, whether it's our government, whether it's our local policymakers or deciders, or even those organizations and institutions that have a responsibility to make these services available, to make sure that folks are trained and competent to respond to these lived experiences, there are folks resolving some of these issues every single day by any means, and we don't collect that information. We don't listen and turn what I call lived experience as data into something actionable. Yes. And so being able to really dive deep and level out what we know that's happening in community, what are women already doing and how are they already doing it, and what is it that we need to do to figure out how we can generalize that, how do we replicate that, how do we make sure that they're able to share that, and not only in those ways that are isolated and independent, like in social media, but actually in structural and competent ways that sharing that information would allow other communities to build and thrive as well. We already know that communities community-based organizations, community groups, civil society. We do the heavy lifting. We do the down and dirty, as my Nana would say, the real nitty-gritty parts of the work, but don't have that same level of equity in terms of who decides, who gets to prioritize this work, and then make sure that the investments in that work are equitable, and also educating people about the fact that they even exist. Because that's the other part, is people don't know where to go and how to get those resources to do what they're already doing. And then being told that, well, the science over here has told us that this is the way to do it. When you haven't been in my neighborhood, so how do you know? When my neighbors are figuring this out already, why don't you bring that into your science?
Yeah, I think the other piece of that, especially around mental health, is stigma. And I think, hard to find a person who can handle the mental health, but also the stigma that comes along with it, that people don't talk about mental health, or they don't have the right names for what's happening with people. And so you see people who don't get treated, don't know how to talk about it, and we need words to explain some of these things that are happening. And so stigma is a big piece of the mental health issue for women. You got to be strong, and you can't, show any weakness and those kinds of things when you might just be depressed. And I think we've learned a lot about postpartum depression, and that's something that's just starting to hit the news. But I think stigma is a big issue too that we have to deal with in our communities, and be able to support people and talk about it and not sweep it under the rug.
Absolutely. I mean, you queued up my next question, which is about stigma, and you mentioned investments. I know, Deborah, under your leadership at Gilead, we've seen investments in initiatives like the Compass Initiative, or in the Radian program, which go beyond medicine to address stigma,
Yes.
Education, and community engagement, particularly in the South, and among women of color. So I'm curious, looking ahead, where do you see the most urgent and the most promising opportunities to close gaps in care for women?
I think some of the things that we talked about up here, which are asking women what they want, first of all, going to where
listening.
and listening, and going to where the problem exists, and talking to people and asking them what would they like to do, what have they seen work. Gilead is a biotech company, and we make medications for HIV, hepatitis, and oncology medications. And as you said, just in the last couple of years, we've invested like $13 million in organizations that are in the community, that are community-based, and are working with women around education of HIV, stigma, and getting people to understand several things. First of all, that HIV can be treated. People can live a long life. And also that HIV can be prevented. And even, I'm sure somebody just heard that for the first time in their life in this audience, that HIV can be prevented and HIV can be treated and people can live a long life. So investing in those communities who are doing the work, who know what needs to be done, and listening to them, I think those are the things that Gilead is trying to do with where the need is. So that's the other thing.
Yeah, this is so well said. I have to get you in the conversation, Allyson. I know you have a lot to say. And by the way, Allyson has a brand new film about her life that just debuted at Tribeca, which I'd love to hear you share about. I had the opportunity to be there and to watch the film, and it was even more powerful. The film is incredible. So, Allyson, I want to bring you into this conversation. You have leveraged your platform to elevate the issue of Black maternal health, and you've done it as somebody who had a lot on the line. You've walked out on your Nike contract, and you've started your own, shoe collection, Seish. If you haven't looked up Seish, you guys, You need to Google it today and support this woman's work. And it's not just about supporting the work. The work is good. I learned from your film that actually Nike and no other footwear line actually create shoes for women. They're actually like, we're just like treated like little men, like little men's feet. When we know we have our own specialized needs as women. So I wanted to kick it over to you to talk about what impact do high-profile voices have in disrupting stigmas and advancing health equity? And where have you seen that power in action?
Yeah, I feel like, we really have the power to share our story and to create change and to make people aware and feel less alone. I know when I was going through my own issues, around maternal health, and I gave birth to my daughter 2 months early, and she spent a month in the NICU. I had a severe case of preeclampsia, and I had no idea about the crisis that we were facing in America and what was going on. And when I was doing my research and trying to learn, and when I saw that it did not discriminate, it didn't matter that I was an Olympian, it didn't matter that I was in the best shape of my life, I still found myself in a hospital fighting for my life and my child fighting for hers. And I think that just shows, what a huge issue this is. But I will say that sharing my story, I think it has really shown that it doesn't discriminate, and it shows that even the strongest, even those who are privileged, who have great medical care, also fall in these same circles. And I think we need more people to speak out. We need to raise the awareness, but also to hold those accountable and to have urgency around it as well. I mean, this problem has only grown. I think it's shocking that for me to give birth is more dangerous than it was for my mother to give birth. I mean, which way are we trending? It's just alarming, the statistics that we know to be true. And so I think we have to continue pushing this conversation and pushing for change at every level in order to see better outcomes.
Absolutely. Kendall, I'd love to hear you chime in on this as well. You do have a public profile and, ostensibly a lot to lose for standing up for what you believe in, depending on what you believe in. And it's in times like these. So can you talk about the impact, both the impact of using your voice in this moment, but also the fear factor that comes with that?
Absolutely. I think anybody, and I'm sure, Allyson, without speaking for you, the pressure is very real. And it's interesting when you go about something from more of an athletic perspective, it's a controlled pressure that you almost get used to. You train for it. It's a different pressure when you're speaking publicly. I'm sure, Elaine, you also probably feel this as well. Anybody with a public platform today, it's very easy for someone with a nameless, faceless account to spam, create rhetoric, create drama, create a narrative that is just not true to your values. And it also, in almost a positive way, their negativity asks you to stand up, and it asks you to stand prouder, and it asks you to speak louder. And yes, it's very scary sometimes, and sometimes people can say some things that can hurt, but when you recognize the why, when you're aligned with what the mission is, the mission of helping other women, the mission, for me is destigmatizing mental health, helping provide support, helping make a change, making sure that people have access to the needs of their mental health, it's worth it. It's not always easy, but I don't think there's a choice now.
Yeah.
You have to speak, and if you don't, candidly, why do you have the platform?
As the kids say.
Little mic drop moment there.
Thank you for that. I think we all need reminders of that, especially in this time. All of you live and work at very interesting intersections. Talk about what happens when we truly collaborate across sectors and how we can build more bridges to really accelerate the impact that we each want to have in maternal health. And that's kind of open to the group.
So I really want to dive in because, especially off Allyson and Kendall, and thank you all for standing up and for putting your neck on the line, if you will. Because there are those of us who will, I'm an old act-upper, so there are those of us who have literally laid down in the streets and have had to answer for that locally, but not in that same public sphere. But the idea that we're not going to get through this without collaborating across all the intersections is a dead idea. We have to, right? And I'm going to give two very concrete examples about how that works in two very different ways and why that's so important, especially for organizations like Sister Love. First of all, our intersectionality is not just about the topics, like how we bridge sexual, reproductive, and maternal health, but our intersectionality is also in the response. We're not only a service provider, we're also a policy and advocacy group. We're actually extending ourselves into doing justice and law work now. And we're also a community researcher. So we put all of those things in the same place to deal with all of those issues. And a good example, I will call their names: Amber Thurman, Candace Miller, and Adriana Smith, 3 Georgia women who in the last 3 years all had maternal health problems, maternal health issues that had an abortion question. And in each one of those situations, because the law is confusing, or the law is restricting, or the medical practitioners weren't trained, or were so confused about the law, all 3 women died. And they died because they didn't know the policy or their providers didn't understand the policy. But they also died because someone else decided that they can take the choice away from those individual women and their families to decide what happens with their health. Amplified Georgia is a collaborative of women-led sexual and reproductive and maternal health organizations that have come together to support those families, to educate people about the laws, but to also deliver service and care in the way that every single woman deserves and should have. Another collaboration I'll talk about is that very new thing that we have to celebrate in HIV prevention. We have fought for many, many, many years to find a way that women can prevent HIV without having to negotiate with someone else, without having to tell somebody that that's what they're doing, and to protect themselves. And you had, in this case, women who are on the continent, living in Africa, putting their bodies on the line and have demonstrated with, can I use that word miracle? But I think the scientists were miraculous people.
Scientists.
But to really come up with a medicine that these women for the first time showed can prevent HIV, and actually at 100%.
Wow.
Right? These were all Black women who have shown that
Wow.
efficacy, right? And so, but that collaboration started when the scientists at Gilead came into community and sat with us first and said, what does this need to look like? How should this study roll? And not only that, when we put together the study, we want to make sure that we have a global community of not just advisors, but accountability holders who are going to walk with us through this whole process. And now we are at the next level of saying, how do we now make sure that there's an equitable way that not only those women in Africa who put their bodies on the line to demonstrate the success get access, but every woman who needs and deserves to prevent HIV and to prevent the maternal health problems or potential challenges, how they can get access to these medications and the education that these medications exist.
These are the stories I want to hear.
Yeah. Well, let me just add to that, because this is just tells you how far we have come. When I first started as a nurse practitioner, I was working in research where we were looking at transmission of the virus from mother to baby. And we knew that if you treated the mother, then there was no virus for the mother to transmit. And I always say that was our first prevention study. Yep. But it was women and children. So it didn't get a whole lot of press, if you will. But it did change the guidelines so that now all pregnant women are screened for HIV before they have a baby, because we know that we can prevent transmission. And I think it really, when we think about maternal child health, it is something that is about community too, to your point. I think, it's the woman who may be pregnant and she's gonna deliver a child, but you need the support of the community. And I think some of the things that have gone away are things like people are not fighting for sex education in classrooms. How many young girls don't even know how their bodies work? And I'm old school. I had our bodies ourselves, and some people will know what that is, and some people will not. But it was a book that I made sure all the young girls in my family got, because you need to know your body to know how to advocate for what you want. And a lot of times, sometimes it's just the language is different, and people use different languages to describe different body parts. And if it's a cultural barrier, then you don't get the same kind of outcome. So I think, we need to advocate for more education for our children around this as well. Because everybody in this audience is here because somebody had sex, but nobody wants to talk about it. Nobody wants to talk about it, but we all sitting up here.
I do.
Because somebody
Not my mom and dad, no.
right? Well, they got down at some point, so. So that is, I think those are how we normalize some of that. I'm not saying we have to talk about it at the dinner table and all that kind of stuff, but it is something that I think, it's around stigma again, and stigma is what's hurting us more than anything.
Absolutely. Thank you for the levity, by the way. We all needed that laugh. I don't know about you guys. Allyson, as somebody who, or not to bring it back down, but as somebody who almost lost your life in childbirth, I'd love to hear you speak to how you see storytelling as a way of rebuilding systems that better support women and babies. You've done it so beautifully. Would love to hear you speak to that.
I think it's critical. I mean, Elaine, we've had this conversation before, but I think we have this idea in society of what birth looks like.
Yep.
And the stories that we have been told around birthing is that it's the most painful thing. It is an awful experience. We always hear the trauma stories.
Yep.
And so I think you get better outcomes when you start to reframe the conversation completely. I mean, I did have a traumatic experience with my daughter, but I learned so much that when I had my son, the care that I got looked completely different because I knew what to look for. I knew what to ask for. I had a doctor who looked like me. I had a Black doula. I had a Black midwife. And all of that contributed to a better outcome. I was able to have a VBAC, the natural unmedicated VBAC that I wanted to fight for, and I had people who supported me through that. And I think because of that, I was able to have a much healthier situation. And so we need to think and be so intentional about the stories that we tell around birthing and what it even means to, what does a doula mean? What does a midwife mean? And who, how can you have those services? And back to how are we supporting families? I mean, the work that Birth Fund is doing to support families around these very issues is incredible and so needed. And so I think when we start to really begin with the community and at the grassroots level and what our villages look like and what the support looks like, and really go back to things how they used to be done, in a much healthier way, I think then we really begin to change, just women, Black women dying when they're giving birth.
Absolutely. Absolutely. So well said. I think this is why I will not shut up about my birth stories, because they were positive, they were more transformative and sacred and beautiful than I ever even knew to dream of. And I think it's important to not just be told what to fear, but what to hope for. Mm-hmm. And that's the power of positive birth stories and storytelling in general. And I also just want to thank you, Allyson, because you are someone who has put funding behind the values that you are up here talking about. You are someone who isn't just telling your story, but you are actually funding solutions. And through Allyson's Pivotal Ventures Fund, Birth Fund has been funded. We haven't formally announced it, but here we are at the Hollywood Reporter Social Impact Summit announcing that Allyson has come on as a front-facing funder, and we just are so grateful for your contribution to the community grassroots effort that we need to see more of right now. We have to stand in the gaps to save these families. We can't wait for someone else to do it while we are working on changing policy, while we are working on rebuilding these systems. We have to save the people who are falling through the gaps now, and Allyson is doing that. So thank you. And kind of building on what you were sharing, I think too often we are not addressing problems until they become crises. And so how do we move from a culture of crisis response to a culture of prevention? And what does that even look like? What does early cultural competent intervention look like in each of your work?
Well, I think, in my work, I work in HIV mostly, and I do some oncology, but in that work, it really is education. It is education and taking stigma out of, like I said, talking about sex, talking about HIV. HIV is a virus. It's not about the person. And I think that's one of the language that we use is very important a lot of times, like someone gave somebody HIV. No, the virus was transmitted from one person to another.
Yes.
I mean, that's a whole nother way of saying that. When I work with women who are HIV positive and pregnant, you would hear nurses say, well, you don't want to give your baby AIDS. Well, no, that's not, who wants to do that? But I want to prevent the transmission of the virus from me to the baby. And so language is key, and I think that's part of being culturally competent, but also just knowing how to use your words is important.
Yes.
And then also having some compassion about people in the situations that they're in, because I think when it comes to health, people feel vulnerable sometimes when they show up at clinics, and you don't know necessarily what it took for them to get there, and there's a lot that goes into people showing up in front of someone for their medical issue, and I think those are some of the things that need to be taken into consideration. But right now, people have like 10 minutes with a doctor, and it takes 6 months to get an appointment. And so I think that's where education comes in, where people need to learn some things for themselves so that they're not just totally dependent upon the healthcare system. I think that's one way to get started, but I'll let everybody else comment.
Just so I wanted to make a quick update for you two on Our Bodies Ourselves, just in case this is news for folks. As someone who is a co-author in some of that, OBOS today is alive and well. So Our Bodies Ourselves is now a living, changing document that's online that you can access any day. It's got peer review articles. It also has resources. So Our Bodies Ourselves is still a resource.
Wait, for the Gen Zs in the room,
Exactly.
break that down. What is this? What is Our Bodies
Our
Ourselves?
Bodies Ourselves is the text that Deborah talked about, which basically was the Women's Gynecological Bible for so long in the 70s, 80s, 90s. And in the late 2000s, it has switched to becoming an online and a living document. There are so many different groups of us who are constantly reviewing and adding articles to that space, stories, lived experiences, as well as resources and organizational practices. I think there's a couple other things I would say that we're engaging in that I think is different. I don't trust the schools to do proper sexual health education because they're so localized, one. Two, because it's so disparate in terms of what state by state will do, and because not everybody who is even in the responsibility of teaching it got that education. And so I think community level sexual health education, which will include the historical context of where we've come from to where we are, and understanding the role that doulas, midwives, community health educators, traditional birth attendants, as well as those go-go's or those nanas, those elders in the community who will tell you those little bits and pieces about that knowledge of what they knew, how they prevented a pregnancy before there was a contraception. All of those things matter in the conversation of what kinds of choices people have today. I also think that in addition to understanding where people are, it's understanding where, not just where people are, but where people want to be met. And I truly believe that the work we do has to be a lot more mobile. People should not have to be mobile to find healthcare. Healthcare should be mobile to find the people. You shouldn't have to go more than 2 miles to access the healthcare that you need, the health information, the health education. And so the more mobile we can bring health to communities, especially those that are in health and food deserts, the better outcomes we're going to have. And so I'm on the mission to build as big a fleet of sexual and reproductive health clinics that are mobile as possible, so that folks know when there's a service available to them that they can go to, and they don't have to leave their homes. They don't have to figure out childcare and then have to figure out how to pay for it. Or transportation, which may or may not be public and or friendly to them. I mean, big ups to the brand new news that Uber is now allowing women drivers and women riders to connect with each other, right?
Finally.
I want to acknowledge that is what centering women's lived experiences looks like. And if we could do the better job of that in healthcare, oh my.
That sounds like a movement.
It's what I do.
I want to get on board. I want to get on board on that fleet.
I couldn't agree more. And with that fleet perspective as well, I have to be honest, our bodies ourselves, I think, was a little bit before my time. I'm very excited to read this online version of it, actually. I can't wait to share it with my friends. But with that, as somebody who grew up a little bit more as a digital native, I see a really big opportunity and a very large gap, in fact, in this information. So it's interesting what you speak about physical communities and the importance of that. And for me, and someone who comes from more of a digital space and has a digital reach in a digital community, how do we bring both of those elements together? So, for example, I know I was researching, something about an intrauterine device, and Elaine and I were talking about this before, and I went onto TikTok, and I about had a panic attack with all of these stories. And you hear the worst. It's exactly what you were saying, Allyson. We hear the worst of these stories, and it deters us from making decisions that are educated for our body. And I have the privilege of having my boyfriend's family as all OBGYNs. And I was very lucky to be able to have this experience of speaking to his older sister, who's in residency right now. She just gave birth to twins, so she knows it from all the angles. But I asked her questions for an hour, and over text really quick. And I remember getting off of that conversation and thinking, gosh, every woman should have this. Every woman should be able to have access to answer those questions in a way that she feels comfortable to make these decisions. So what gets me really excited, and where I think the opportunity actually lies, is in bringing those local communities together with conversation that was spurred in the digital space. How can we create these digital environments where you could potentially not have to share your public information, and you can find kinship, you can find community with people with shared experiences on the internet, and then be able to bring that knowledge, bring that community, and bring the digital side of support into these community spaces. And hopefully even, it'd be great sharing, the elders' perspectives. Please, go on TikTok. I will tell you want to blow up on TikTok right now, be over the age of 25 and just tell us what to do, please.
Yeah, I think there should actually be a whole, what do they call those, where there's, TikTok spaces, like there's Black TikTok. There needs to be that TikTok that's just like, who told you that?
Oh,
right?
Okay, I think we just started now. We just started a new series, everyone.
Please, and then
Just
read me
bust
for filth if
everything
I
out
have
there
it
that's a
wrong.
myth,
We just,
right?
we need someone to kind of check us and guide us and be that, because lived experience is so powerful, and we have more access to information than ever. We're more connected than ever, but we are deeply isolated simultaneously. So how do we take our digital world, bring it in with the strength and the experience of the elders and the people in our community and these intelligent people in our communities, and affect change so that people are empowered to have access to choice and are educated to be able to have that proper choice for their bodies and make an impact?
Kendall, I think a public service would be getting these two women on TikTok today.
I'm about to get them to sign up to an account immediately.
Because the bars that have been dropped,
That's what I'm saying. It'll go viral so
you guys
fast.
would go viral 10 times over just based on what you said today.
Yes.
We'll talk about this backstage. Allyson, let's kick it to you.
I see it the same way in maternal health as well. I think what you're talking about is storytelling and really getting the message out. And I think about preeclampsia. And one of the things that we know that can prevent in your second pregnancy is a low-dose aspirin. But how many women are familiar with that? And so it's this education, it's being able to talk to your doctor and have your doctor actually give you that information that you need. You were talking about 10 minutes with your doctor, and that's what is normal. That's absurd, right. Especially when you're dealing with these issues that are life-threatening. And with preeclampsia, there are things that you can look look for that when you're at risk, whether it's swollen feet and headaches and changes in your vision. And so all of these things you have to be educated on in order to know what to look for. And so there's so much work to be done. But I think what makes me most hopeful is knowing that so many of the deaths and complications that Black women face around maternal health, I think the statistic is something like 80% are preventable.
Yes.
And that's heartbreaking, but that's also, there's hope there because we can do something about it. And it's going to take everybody coming together to change those outcomes. And I think everyone in this room is really energized around that. And we've got to do that work. I had a very unique experience because I went through a hardship, as an athlete who wanted to start a family and not being supported. And so I was absolutely devastated by the way that I was treated. And because then I went on to start my own business, I had learned so much from my personal experience. And I also had this outpouring of other women who had experienced something similar. And so because I had that lived experience, I was like, there's absolutely no way that I want anybody else to walk this path. And it was like, if I get to build the thing, I'm going to build it in this way. And I think it starts with what we talked about earlier, deep listening, understanding. How can we support women? How can they show up? How do you have maternity leave? How do you come back? And how are you building companies that do that from the ground up? And so I think it is taking some of those practices, from real life and saying from a humanity aspect of this is a real person. Yes, we work for a company and we do work that we're passionate about, but at the end of the day, we all want to go home to families that we love. How can we support in a better way? And I think when you do that from the ground up and you are able to model that and really be transparent about it, you can hold other people accountable and say, do you want to come alongside and do this way as well and really be leaders in the space?
What did I say about the power of a pissed off mother? As we wrap up, I would like to pose one final question to each of you. We are here talking about building a future where every woman, no matter her zip code or language, sexuality, income, they receive the care that they need and deserve. It's going to take bold vision. It's going to take collaboration across sector. And so I'd love to end on possibility. Right? We need more of that in our conversations and in our spirits. So I'd like to ask each of you to share one commitment, personal or professional, that you're making to help move us closer to that goal.
My commitment, I was speaking to somebody about this earlier, is I am trying to get more young women to go into healthcare. I think that it's a profession. I mean, I went into healthcare because I was like, I'll never have to worry about getting a job because people can always get sick, right? So I think that one of the things, I think more people going into healthcare and going back into the communities that they work in. That's one of the commitments that I'm working on because I think that is very important for some of the communities where there is lack of healthcare providers that are trusted because mistrust, distrust, either one of them are big issues right now in the healthcare system. So I'm always trying to advocate, not necessarily even to be a nurse, but to do something in healthcare because there's so many opportunities there and there are not enough people who look like me in the places that I go. So that's my commitment.
That's fantastic.
Yes.
All right, we'll go down the line.
Well, one of my commitments that I express here now and will continue to work on is continue to build solidarity. Building the solidarity across these different stories, whether they are maternal health stories or stories of sexual health like around HIV or reproductive health stories around abortion, birth control, contraception, and family planning, that the commitment is making sure that we're in constant conversations. For example, we rarely have conversations about fertility assistance as an equitable service or healthcare. It is not a luxury for those who can just afford IVF. There's no public support for people who can't afford it, who want to build families. So building that solidarity in those stories. But the other part that we're really working hard on, at least with Sister Love, and what my commitment is to really closing this false division, closing this gap between community and corporate and public service, right? That there's this disparity that's existing. People, the minute you say, oh, I'm a nonprofit, that changes how people even look at you, right? But we're small businesses. We hire people. We pay taxes. We have services. We have products. We have things. And I know that there are, for example, you have corporates, you have big private companies that have nonprofit sectors that are foundational. Nonprofits can also have profit sectors that are educational, that are community-based, that continue to deliver services, some for those who pay and some for those who still need it without pay. That's the divide, I think, that us and them mentality has to be erased, and that's my commitment, is working towards that erasure.
Thank you.
Yes, absolutely. With what we're doing very early stage at NKO Fund, with what I continue to do in health and wellness, fitness in particular, destigmatization of mental health is absolutely massive. Being able to talk about it, be that storyteller, show the vulnerability, and create space for people to share their stories is absolutely operative. With that, a goal for us for the end of 2026 is to launch a scholarship fund for BIPOC students who want to get into the mental health field, because we need to have representation for all communities to be able to go and do that internal work, and at their most vulnerable, to feel safe, to feel heard, and to be able to thrive through that process.
Yes.
Fantastic. Allyson?
Yeah. My commitment is really to come alongside organizations who have been doing important work in this space and provide funding. And a lot of the organizations that are doing work on the community level, I think we have to support those organizations. They are the ones who are on the ground and who are really changing outcomes. And it might seem to be a little bit at a time, but really committed to furthering that work, amplifying it, and yeah, all coming together to create better solutions.
Well, I will answer the question that I posed as well in two ways. One is a funny answer, but one is serious. At Birth Fund, one of the things that we're focused on is expanding our programmatic work to start a scholarship program for midwives in training, because we know that there are so many structural challenges that midwives and community birth workers face to just getting into the industry, to just getting into practice, let alone staying in practice, right? So that is something that we are currently raising money for anyone in the room. If you'd like to talk after, shameless plug. But the other thing I want to say is I think our contribution to the digital community at large is getting these ladies on TikTok today. So that is our commitment, Kendall.
Let's go.
Okay,
I'm going to get the phone out. We'll get the accounts going.
Let's do it.
I need a good name too. I'm ready. It's going to be good.
Do you already have one?
No.
Okay.
But it'll gestate.
Yeah,
we'll get
matcha,
there.
and we'll get there. We'll get there. Thank you so much. What an incredible group of trailblazers, of powerful leaders. I feel fueled by this conversation. Thank you so much, and thank you for everyone for being here.